baby has come a long way in just a few short weeks. That little head is taking on a rounder, more human shape, and by now all the internal organs should be in place and starting to work together. Tiny tooth buds have begun to develop, too. Your baby's fingers and toes are growing longer, and the webs that had been between each finger and toe are starting to disappear. At the moment, your baby's eyes, eyelids, and ears are continuing to develop, but they've still got some growing to do before they're fully formed. What's in store for both you and your baby until you're able to look your little one in the eyes for real? At 10 weeks, the average fetus is about the size of a strawberry, measuring approximately an inch from crown to rump. Your uterus is about the size of a large orange at this point, whereas before you became pregnant, it was about the size of a small pear. Around this time, you likely have had or will soon have a visit with your healthcare provider for a thorough examination. At this appointment, your provider may do an internal and external abdominal exam to determine the size and position of your baby, as well as take blood samples for a variety of other tests. These blood tests may be used to determine if you have any infections, what your blood type and Rh factor are, and whether your own immunizations are up to date. There's a lot to do, but your provider will be able to walk you through the details and schedule future appointments and tests. Your symptoms. Morning sickness. The good news? You're likely to start feeling better soon. Morning sickness often goes away after you enter the second trimester. Keep in mind, some moms to-be experience a more severe form of morning sickness called hyperemesis gravidarum. If you suspect you may have this, speak to your healthcare provider. Round ligament pain. Of all of the pregnancy symptoms you may be experiencing around this time, this one is among the most uncomfortable. Round ligaments are two of the ligaments in your pelvis that help support the uterus, and as your baby grows during pregnancy they stretch and soften. When these ligaments tighten, you may feel pain on one or both sides of your abdomen. Changing positions in bed or doing strenuous exercise may bring on this pain. Light stretching and gentle movements may help relieve the discomfort. If this symptom doesn't go away on its own, or if you also have a fever, call your healthcare provider. Minimal weight gain. Even though your clothes may be fitting a bit tighter, you may not have gained much weight, and you may even have lost a little if you've been dealing with morning sickness. Exhaustion. You might feel like napping at every opportunity. This could be thanks to the increased levels of the hormone progesterone in your body. Headaches. Some moms to-be get the occasional headache during pregnancy. If you're experiencing this symptom, try to rest in a darkened room and apply an ice pack to your head or neck to help relieve the pain. Contact your healthcare provider if the headache persists or is severe. Mood swings. Hormonal changes may play a role in the highs and lows you feel when you're about 10 weeks pregnant. You may find it helpful to distract yourself by chatting with friends, watching funny TV shows or movies, or treating yourself to a massage. Just be sure to choose a trained masseuse who knows about safe massage techniques for pregnant women. Vaginal discharge. You might be seeing more vaginal discharge than before, which is caused by your increased blood supply and higher hormone levels. This normal vaginal discharge is known as leukorrhea, and you can expect to see a clear to milky-colored, nearly odorless discharge that may appear slightly yellowish on your underwear. Contact your healthcare provider, though, if you notice a strong odor or color changes, or if you experience itching or bleeding around the vaginal area. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born. Things to consider. Reduce your caffeine intake, if you haven't already done so. Cutting out caffeine can also help you sleep better. As your pregnancy progresses, the weight of your growing uterus can hinder blood flow to the lower parts of your body. When this happens, the veins in your legs can become swollen, sore, and blue. Don't sit with your legs crossed or stand or sit for long periods of time. Also, stay active, move around, and add some safe pregnancy exercise to your daily routine if your healthcare provider approves. You may not be showing for a few weeks yet, although some moms to-be start showing a little earlier than others, but you might like to think about starting a baby bump progression photo series, if this is something you might like to do. You could start as soon as you start showing, or even a little earlier. Pick a day of the week, where you'd like to stand and what to wear. Once your baby is born, you can even take a few postpartum shots with your baby in your arms. You'll love being able to look back on how your belly grew as your pregnancy progressed. Things to ask your doctor. When can you hear your baby's heartbeat? When will you be able to know if you are pregnant with twins? 10 weeks pregnant, your checklist. Get a professional bra fitting and buy comfortable underwear and well-fitting bras if needed. Start to plan a second trimester baby moon. You're nearly in the trimester, which is sometimes called the honeymoon period of pregnancy, when you may get your energy levels back, so this could be the right time to take a short break. Besides, after the second trimester, you may not have the chance to get away for a while, so this might be the perfect time to book a relaxing trip. When you have a minute, read our article on pregnancy warning signs you should not ignore. That has been Pregnancy Week 10. If you got any value from this video, hit the subscribe button. Subscribe to the channel and don't ever forget, you know how to mom.